Thereafter, it's okay with everyone, I'd like to call the meeting to order. Welcome, everyone. Do we have any new faces, or should we do a quick roll, name, just so everyone remembers everyone else? We'll start out with you, Kristen.
Christy Alberson, grant writer for the Health District.
Arvinder Singh, Chip Coordinator, Lake County DOCCO.
Cecilia Montgomery, resident.
Many hats. Diane Clay, I'm with the hospital auxiliary and whatever, food charity.
Larry Coulter, long-term care.
Janine Sims, nurse at Lake Health Clinic and co-facilitator of the Living Well program.
Rochelle Hanson, food corps service member.
Sheree Morgan, Lakeview Gardens Long-Term Care and Senior Center.
Paul McGinnis, Greater Oregon Behavioral Health and the Eastern Oregon Coordinated Care Organization.
Alana Shamulak, the Eastern Oregon Healthy Living Alliance.
Jamie Davis, Oregon State University Extension Service.
Ron Harwood, older adult behavioral health specialist with Greater Oregon Behavioral Health Program.
Beth, can you introduce yourself?
Beth Hadley with Public Health.
Darwin?
Carl Johnson, Lake County, Town of Lakeview School Board. Jimmy Hall, Lake County Examiner.
Thank you. Welcome, everyone. And Beth, Darwin, we do have seats up here.
I know.
I'm good.
So you don't feel like you're not a part of it. Those of you that know that we have Charlie Twig, the hospital CEO here, and the chairman. So, did everybody get a chance to look at the minutes we mailed out? If you have, I would entertain a motion. The minutes.
A motion to approve.
Thank you, Larry. Do I have a second?
Second.
Thank you, Diane. It's been moved in second. All in favor, please signify by saying aye. Any opposed? Thank you. Arvinder, let's start off right away with you on our community health needs assessment.
Thank you, Charlie. Good afternoon, everyone.
Do we have anybody on the phone?
No,
We got that. Okay. And we have two new arrivals. Would you like to introduce yourselves, just so everyone remembers who you are, because we have short-term memory?
Sure. I'm Andrea with the Senior Center.
I'm Noni Moss with the Senior Center.
Thank you, ladies. Glad you're here. Sorry.
Namaste. Good afternoon, everyone. So I'll start with the community health needs assessment. So community health assessment is a systematic examination of the health status indicators for a given population that is used to identify key problems and assets in a community. So as a result of Section 9007 of the Affordable Care Act, all non-profit hospitals are required to conduct a needs assessment every 3 years. It is time for Lake Health District to carry out its needs assessments. The first step is to form a core team. This is the core team that was formed. We have a representative from CCO and the CAC. We have representatives from the local health department, a hospital representative, and from the Office of Rural Health. For the next step of the community input, Lake Health District is planning a community-wide participation meeting on June 29th at the Elks Lodge. The date hasn't been confirmed yet, but it should coincide with the next CHIP meeting. We want around 60 to 75 participants from Lake County to attend the meeting so we can carry out a survey. And Paul, can you share some information on what to expect in the meeting?
Sure. This requirement, we tried to match with the requirement of the CCO to do a community health needs assessment at the same time so that the hospitals around our region weren't having to do the same thing a year after other groups had asked them. So public health departments are also asked to do a community health assessment, and I forget what your timing is, but when Mira was here, we were trying to get that to dovetail so that it wouldn't happen, but we're a year off here is really what's happening. So rather than going through all kinds of different processes that had input from people like we did with the CCO assessment, we're going to summarize what the data is, update it, and then the IRS requirements you have to describe how the community has heard that and prioritize what it thinks is important. And how we're going to do that with 65 to 70 people is through the audience participation clickers. We've used that here so that we can get input from people very quickly. It'll already be dumped into a saved program so that the hospital can meet its requirement by posting the results on the website. This kind of got kicked in because the IRS or somebody from the IRS was cruising hospital websites and found one over on the coast, and apparently they got fined 50 grand or something like that, Charlie. Well, maybe they were appealing it or something, but you know, so we need to be efficient with people's time because we've already asked a lot of these questions prior, but it will need to be timely. So once they're there, our vendor and I and others will, you know, quickly present some of the key demographics, economics, social determinants of health functions, those kinds of things, and then get people to rank and prioritize. We think probably 3 or 4 hours.
So will you be sharing some of the secondary data that you already have as far as identified needs and getting input from along that?
Yeah.
And I'm working with Paul on identifying ways for people to participate remotely if they can't show up for the meeting. I know there is this software called Zoom which allows polling to be done online. So yeah, start spreading the word. Do I have any questions or comments?
It would be nice if this group could be used as a core, where, you know, because if I heard you correctly, there will be no June CAC meeting. This will replace
This
it.
will be the CAC meeting.
So, you know, the best way to get the right people to that meeting is if you invite some folks based on a list that our vendor can send out to make sure that we do have like representative of local government and other folks, people who deal with parks, people who deal with the food programs and schools. I mean, just think about how you slice and dice any community sectors, and we want representation from those folks. So help our vendor who may not know the community as well as you guys do. I haven't only been here a year or so. You been here a year yet?
7 months.
Yeah, he needs help, so please help him out.
Is it going to be at the same time of the day?
It's gonna be from 11 to 3. So we'll be providing lunch. June 29th at the Elks Lodge.
Arvinder, do you have a date set for North Lake also, or are you going to do one up there also?
So these are the assessments for the hospital.
Oh.
So it's about who all we serve, and Paul just told me that we probably we can inform them about it.
You can define your community.
It's also, I think, it needs to be within the purview of the district. And since North Lake is another health district, we would really, while their input would be valuable for the county, we would need to have their approval for us to do anything involving that community. So, not that it's not, makes sense to do, but for right now, we would need to, this really needs to be addressed through the health district.
Thank you, Paul. going to the next topic, so we had come up with the idea of Outback Strong earlier this year to break the taboo of relating anything healthcare related with weakness in Lake County. So we decided on Outback Strong to be the brand with which to lead all the CHIP programs. We have a budget for hiring a graphic artist to help us with the logo. Stevie Ruda has provided us with several designs for which I thought it would be nice to get your feedback. So I have already shared these logos with quite some hospital staff, and so number 4 and number 6 seem to be the most popular ones. So I was thinking, with a show of hands, could I have a vote in this room? I'll give you some time to absorb the design.
Can you share how these will be used, because that might make a difference?
So we'll be using them on letterheads, then usual
Mugs, t-shirts, like all the swag that you had.
merchandise. We'll also be using them on posters.
Yeah, air flyer, which if only we'd had it before. It would have looked better on here.
Okay. So branding, right?
I think it's hard to see that.
I don't know if it's just me or not, but when I first looked up, I thought Outback on number 5 and 4. You know, it's,
That tail.
the tail of the B would need to come down, at least in my mind,
Yeah.
on that one.
Yeah. So we can definitely modify the design. So what I was thinking was, we will decide on what we all like in this room the most, and then again we'll get back to the artist and she can make some changes, like change the font or some color in the logo. So with a show of hands, could you vote and tell me if you like number 1? Does anyone like number 2? Number 3? Let me just keep a note of that. Number 4?
Can we vote more than once?
You could.
Oh, good.
Number 5? Number 6?
So weird. Yeah.
So we got 7 votes for number 4. Was that your favorite too, Krishna?
That's my second favorite.
That's the second.
Which one?
Number 4.
What's the next highest number?
The next highest number, it's a tie between 3 and 6.
With how many?
3 each.
I think as far as what Paul said again, I think the font on that would need to change because of the
Yeah.
That's what it's called.
Yeah, make a note of
She
that.
might be able to, I mean, the font
Bring
is
it
the
up.
font, but she might be able to.
Say it now. Say it.
Well, it's our county logo.
Was the appeal on 6 the caduceus, which is the medical sign,
Yeah.
or the shape?
No, the caduceus.
You like that?
I like that, that tells
Maybe it's a sunset.
we're connected.
My concern with that, if I can share it, is that it's supposed to be bigger than the health district or than,
Yeah.
if the extension office is using it, if the schools are using it, if it's not a healthcare related thing, that's my concern about that.
Limiting, yeah. Because I probably wouldn't use it with the medical symbol.
Because it's about prevention, right?
No, it's bigger than just.
Population-based, so. I like just the emphasis of the big word strong. I think that's what appealed to me about free. And it's clean.
Yes, it's easier to read.
So maybe we should have a revote. Oh, darn.
So I just have a quick comment. So if that's Aber, you're never seeing the sun over Aber like that. It doesn't come up there. So I've always been irritated by that, but the town uses it well as well, and others do. That's why I like number 5 more,
Okay.
just because of the But the county has switched. That used to be very much like the county's logo as well, but we switched to just clouds in the background.
So what if we took off the sun and said, because I can tell you, I like the circle, because that to me helps to create a wholeness rather than just the word strong. And
The other part about 4, it's really hard to see out back.
If we reversed the type and made it white though.
Yeah, if you did it, something different about that.
So
Like
we
either
can
the print in white or
Yeah.
put it in white behind it like you did strong. Because both those words are the logo.
You can have your Outback rising.
so if we were to change the outback word to in B, take off the sun that never rises over 8 like that. And that's on number 4. How many people would feel comfortable with that? Hands, show of hands.
Can you say that again, Charlie? You're gonna take that
Here,
Outback
just my
to
suggestion.
5 and put it above the no sign?
If you take this word,
Right.
put it in white, the same as this, only fix the pack to be back. Take away the sun that doesn't rise over a rim like that. So had it look like this, or not that color, but this without the yellow. If that were the case, how many people would choose 4 over 3, or what was the other one? That was 6 or 6.
Yeah.
Show of hands.
Oh, I would, yeah.
Looks like that looks like that would work pretty well. Can we ask the,
But wouldn't it just be like having 5 with strong in the box almost, and then the.
except the bottom of 5 is not full
Yeah.
circle.
Yeah, they're really similar, but.
Charlie saw the Lion King, you know, the circle of life.
Oh, okay.
Our grandchildren saw.
I'm sure the graphic artists will do this on their own, but from a graphic design standpoint, if you take that sun away, you're gonna either have to put Outback in the sky or put something up there
Yeah.
to balance
Space.
the color and the spacing.
You could have some
So maybe
clouds.
ask her to come up with a couple of
So kinda like
different
what
versions
5
of
is.
the board.
Like what
Yeah.
5 is, but round and round, and then strong in the box would be perfect.
Once we make these changes, we'll bring it back.
Okay.
How's that sound?
Yeah.
Is that gonna be enough time, Christine?
It's gonna have to be done via email, so we can start getting stuff.
Yeah, I'll send it out on email because our next SHIP meeting might be later than usual.
Okay, so if we can do that and have everybody respond within a couple days saying yes or no?
Yeah.
And see, if you put Outback up there where blue's at, it doesn't need to be white. It can be
Yeah.
black.
Yeah.
Black is good.
Yeah, but we'll have to change the font.
Okay, you have enough information?
Yes.
Excellent.
So now going to the CHIP updates. So for telehealth, telemedicine, we were ready to place the order in early May. However, the organization we were going to receive the equipment from lost their licensing. So the purchasing process got delayed. They have since renewed their license, and I, with the IT director, Stephen Wans, are going to place the order tomorrow. We have a conference call with them. There have also been new developments with the telemedicine telehealth project. I and Christy met with a representative of the RUS DLT program, the organization that we were awarded the grant from yesterday, and we were informed that we are not limited to just the ED crisis workers for the telemedicine project. We can use the telemedicine for other departments and use grant dollars for working with different vendors. So I'm going to meet with our clinic managers and rethink about utilizing telemedicine. Things like pain management and dermatology were scrapped earlier because we thought we could not use the grant dollars for those. We were only limited to ED crisis workers, but that's not the case now, and we are now flexible with the budget. So yeah, there'll be some new updates about the telemedicine project in the next SHIP meeting. Any questions or comments?
Remind me again which grant this is and who it was from?
It's called the RUSDLT.
It's the Rural Utility Service Distance Learning and Telemedicine, so USDA program.
It's from Washington.
We got it.
Independent of Gobi.
Yes.
Oh, yes.
Okay.
This is a $150,000 grant, of which $100,000 came from the rural
Utility service.
utility service.
Right.
And then $50,000 was matched, or was supplied by the district.
Okay.
And it was prepared in large part by the vendor, by the equipment vendor. Now, since we have the grant, we can change.
They helped us do the one that we did too.
Excellent.
I have a comment, but I'm not sure what the intent was, or like you mentioned dermatology and a few other projects that you probably aren't going to do, but one thing I've been hearing a need for is people who are diagnosed with certain illness like cancer, where they're having to go out of town to see specialists.
Okay.
And usually that first appointment is a meet and greet, and people are having to go to Portland or, all over. And so they're driving all that way and just basically to meet their oncologist and then, being rescheduled. So I've heard some comments that it'd be great if we had the ability, with the telemedicine to make those first appointments with some of the out-of-town specialists. That meet and greet appointment to save people the travel time. I think that'd be a great use.
Yeah, that's a good point. So we are still going to stick with our original vendors because the wellness center is very interested in collaborating with them, getting the equipment, and have providers, ED crisis workers at Peace Health. So we are definitely going ahead with that, but we weren't able to use a large chunk of the budget with only ED crisis workers. So now that we are more flexible and we can look for other departments, we can use a bigger portion of the budget. I'll definitely look into the cancer. And when I had my discussion with our clinics, so the way the equipment is, it's like a mobile cart. It has a TV and a camera. It has a high definition camera, so dermatology came up because it can like zoom into a person's skin lesions or whatever, and even for pain management. So yeah, so I'm going to have a meeting, and I'll also meet up with you, and all suggestions will be good because we have a good amount of money and should utilize all of it.
Beth, to answer your question about the original intent, this was applied for about 2 years ago. And at that time, the intent was to try and provide to the physicians and in the emergency room mental health crisis services with a physician specifically for the emergency room. And then we tried to see if we could provide that as mental health crisis outside of the hospital in some of the more remote communities. And that was to bring, by telemedicine, a physician in crisis, a psychiatrist in crisis services to those locations. Since that grant was applied for, a lot of things have changed in Lake County. And that's why it's begun to change how we would use that money, because that's not necessarily the best arrangement. That's what really has happened with that. And the good news is the RUS, or Rural Utility Organization, that USDA is operating this grant through, has been willing to allow us to make adjustments. So if anybody has great suggestions to help us, all of them are good, because we don't want to squander the money, but we want to make sure that we use it. That's, so in case anybody wasn't here when that was discussed.
Thank you, Charlie. Any other questions or comments? So going to the Gatekeepers Program, so the update is that now I've sent out 300 surveys, close to 300 surveys, and sent surveys to all the ministers in Lakeview with the help of Eric Sorensen to hand it out to all the people who attend and get a good return rate. Next week, on May 31st, we are going to hand out surveys at the senior center during the meals program. And I'm hoping to get a good response rate from the meals program because we can give them the survey and get it back at the same time. There are just 12 questions. Shouldn't take them long. Any questions or comments?
What, if we could, those that are serving older adults after this meeting, if I can, I will keep for about 5 minutes.
Going to the Outback Strong Health Fair, there have been scheduling conflicts to conduct the fair in June. So we are planning to conduct the fair, we're still in talks. We are planning to conduct it sometime in August around the registration time in the schools. And August would allow us to catch any kids who miss their sports physicals this spring, but still need the physicals done to play soccer, football and or volleyball. It would also give us more planning time, and if this isn't done well the first year, I think it'll affect the success of the program in the future. We also have other options like pushing it to October to tie it in with our flu shots. And any questions or comments?
Sorry, is this the same as Daily Days or is it different?
No, this is different.
Oh, okay.
This is the youth health team.
Oh, that we opted into.
Opt-in grant.
Yeah.
Yes, Beth?
I was wondering, so after this year, would the intent be to then start doing it when the sports physicals are due in June? Once we got going?
So our original plan was to tie it in with the physicals that Bobby Steninger carries out, because then we'll be guaranteed a good turnout. But this year when we got the approval of the grant and I had a couple of meetings with her, so she wasn't too keen on doing it with us. But I guess if for next year we can have a dialogue with her, and because I feel the best turnout would be during June, during the physicals that Bobby carries out.
Yeah. So, and Christy, when does that money have to be spent by? Is it March?
March of next year.
So if we, what I was thinking is after this year, if you wanted to tie it into the sports physicals, maybe we'd be better off to do it just a little bit later, like more like February. And then the next year you could move it, just adjust it by a month or two to get it into that schedule where you want. Because I bet that they won't pay more than once a year, will they, Paul?
Yeah, we don't know if they'll also this opportunity again next year. Do you have any information on that, Paul?
Depends on the success overall, whether or not that'll happen. The answer to your question though is this came up earlier, and the EOCCO has a policy will pay for multiple adolescent well visits from different providers.
Say that again, Paul?
But they would be the same providers.
They determined that they would pay a duplication just to make sure that they're happening. So if somebody did one at one clinic and then the person went to a different doctor and that other doctor did it, they said that they would pay for it.
And the same, so it's any provider?
Yeah, any provider that's eligible that meets the criteria of an adolescent well care visit, they would pay more than, if it happened more than once a year, which was what Beth's question was.
But if a kid saw Dr. Gallagher during Bobby's physical, although that wouldn't count, and that doesn't meet all the requirements for
No.
well child visits, so, okay.
No.
So would a limiting factor or a scheduling help make us a decision based on when the positions are available?
Yeah, so we have coordinated with the clinics, and the providers are, and the clinic managers have told us that the providers are on board with it.
Okay.
But yeah, but we also have, so we're going to have several stations like public health, prevention, CHIP. So for June, we had a conflict of getting all of them on the same date. And a couple of providers also, we had some conflicts.
So, I guess I've been going to quite a few health fairs across all different counties. And is the idea, so if you do it in the summer, you could do it on a weekday, but how what's gonna be the draw to get people there? I mean, because I'm sure there are gonna be parents that their kids did their physical with Bobby, and they're like, we don't need to go to that. Or have you considered like doing it in October, doing it on a school day, so that all of the kids have to be there? I just went to a teen health fair in Grant County.
Yeah.
And it was during the school day, they bussed in all of the kids from every school in Grant County, and they just went through all the stations, and they had to be there.
That was this money too,
Yeah.
in Grant County.
And that went really
Our
well.
school system has not been interested in having it during school day, because what they're saying is, school days are precious, and we need to make sure that we're teaching as much as we possibly can.
Well, I was thinking about if you did it in the, like in the fall, and we did the flu shots, we also could hit, like review kids for school exclusions, their immunizations, where that would really help them to not be excluded. But, and you know what I was even thinking we could do to get a good turnout is, I don't know if we could do this with the grant money, but what if we did it, started in the afternoon, did it into the evening, and maybe if we offered some incentive to like, okay, football team, we'll donate $200 to your team if all your players come. Okay, volleyball team, we'll give you $200 if all your players come. And then, so that the sports kids could do maybe a shorter practice and still come into the evening. Would help the booster clubs, you know, help the sports teams. And then you get, and you could do that with anything. You could do that band kids. I mean, you know, any kind of a group, any club, you get your kids to come. We're gonna donate a little bit to your cause, and then get those kids there. And then there's gonna be a few kids that aren't, you know, involved in any activities, but you could get them like right at the end of school, or maybe the last hour of school, or, you know. So you might get more participation that way, because I'm pretty sure most of the coaches are gonna make their kids go if they get some money through the booster club.
Well, most of the coaches would want it to go too, otherwise they won't be eligible for the sports activity too.
Well, no, because they'll already have had their sports physicals with Bobby, so they'll be done with that, but they'll have to have that before practice in the fall. But anyway, I just was thinking, if we could, you know, and there's pretty active booster club, maybe they could even help volunteer, you know, to barbecue, or, you know, feed those kids some dinner. And anyway, it's just some ideas that I was thinking with the fall. But I do agree with Alana, I think you have to have it, if you have it on a weekend, you're not gonna get people.
Yeah, all the.
And then the summertime, now they're doing registration, you know, over the internet.
Yeah.
And so I think you're gonna have a lot of kids that don't even show up at school during registration. And that's spread out for a whole week, the registration is, so. I think if you had it during the school day, if you could get them to give up the last hour or two, and then have it into the evening.
I mean, if you schedule, so like what they did in Grant County, and I was just at one in Burns last week, they just say, okay, we only want to pull the kids out of class for 30 minutes. So then they figure out how many vendors they have, and say, okay, 30 divided by that, you get, at this last fair, it was you get 6 minutes with each group of kids in front of you, do your spiel in 6 minutes. In Grant County, it was 12 minutes. So it just depended on how many stations they had, and that way the kids aren't missing a full day of school. There's a schedule, they come in, and I mean, they could even bus the kids in from Union for it and run them through it. We could even bus in kids from Public and Adele if they wanted to. It just, the attendance, when it's not mandatory, it doesn't matter how many incentives you offer, how much free stuff you're giving away, unless the kids have to be there, you're gonna miss a huge chunk of them. And you're probably gonna miss the kids that need the fair the most.
Yeah.
So I would say, you know, we still do early release Wednesdays, so it's an hour earlier, so on a Wednesday would probably be best if you work with the schools that might be able to just hold them over for an extra hour and give the teachers who are doing some schoolwork during that extra hour just a little bit of heads up so they can just get on it. Yeah.
Are there special Wednesdays?
All Wednesdays, the whole school year. every Wednesday. Yeah.
Could you tell me what time they are released?
So they get out at 1:30 instead of 2:30 at the elementary, and then it's a little bit later, I think, for some of the junior high, high school probably. but-
Junior high and high school is usually 3, so they get out at 2.
Yeah, yeah, absolutely.
This way you get the kid, the younger kids through.
Get into first and then get right to
Great suggestion.
The only problem is you have to work around the sports, the athletics, because you'll not get the kids there. They'll have to go to whatever sport is going
I'm in a
on.
meeting.
They can't have sports during that time period. There's no
Okay,
practices during
bye.
that time period.
No, but
for early release.
I know because what I'm talking about is we have class Wednesday at 2 o'clock, whatever, and we do not have attendance because they are practicing and their sports at that time. And it's just not one sport, it's all of them.
I think that's a great point, but I think that's why we need to get the coaches on board too. And if they can see the value in it and ask, kind of, they could be really our partners in getting their teammates to come. And especially if, like Alana said, we know how much time it's going to take. Hey, your kids should be through in 45 minutes, and they could postpone practice or finish up a little early,
That would be wonderful.
Yeah,
Yeah.
I think you could get them to participate, but you'd have to get your coaches on board.
Oh, definitely. And other activities after
Yeah.
school.
Yep.
These are all good suggestions. The only thing left is for me to coordinate with the schools.
Are either of you on the call on Tuesday?
Yeah, I am.
Okay.
School's a good strategy. We try to find even just one teacher or one staff
Champion,
member. Yeah, that's really gonna pull for you and can, maybe even if Will and the principals aren't very into it, if enough of their teachers are, they might say, okay, we'll do it on school day.
Any other comments?
Well, I'm already pulling for it, and I'll be on the school board officially in July, so
Thank you.
I'll make that comment at the next meeting.
We appreciate everyone's position, so it's not that we don't understand people's position,
Oh, yeah.
but we think this is important.
Healthy kids learn better.
Going to the Living Well program, Jenny, could you give us some update on that?
Sure. Excuse me, Francie Winters and I are working on finalizing our referral list of participants. And we're planning on starting the first classes for self-management of chronic pain in June.
Where will that be?
We haven't nailed that down yet, but it'll be in June, sometime in June.
Are you going to conduct the classes in hospital or in
I'm
the?
not sure where we're gonna start.
Okay. Thank you, Jenny.
You bet.
Did you get notice about the Master Trainers program happening out of Good Shepherd in Hermiston?
I do.
But if you have a card,
I don't.
I'll make sure I get her email and I'll forward. They're looking, so these are people who can train the other people, so I'll get you the information. It's coming up soon.
Great, thank you.
There's a couple of you guys that went and got trained, correct?
Yes, two of us.
Yeah.
So going to the colorectal cancer screening. So this is again the opt-in grant that we were awarded, incentive measure. So Lakehill District was awarded close to $25,000 for the colorectal cancer screening initiative. Last week we had an orientation from the EOCCO, which was attended by the Lakehill Clinic and Warner Mountain Clinic representatives. We also have the providers on board for the screenings. We are waiting to receive the patient lists from the EOCCO. We'll also be having a station at the Dally Days Fair to spread awareness about the initiative. This is the timeline that was provided by the EOCCO during the orientation last week. It's officially starts in May 2017 and will end in February of 2018. Does anyone have any questions or comments?
Just Warner Mountain's participating, or is the other clinics participating too?
So Warner Mountain and Lake Health together, we are working on it because we received the grant dollars.
So the actual mailings of the fit materials, does it actually, in that letter where it says patient education planning, that kind of stuff?
Yeah.
Are we talking to people about colonoscopies as well?
We have to do everything. We have to. You mean talking to the people we'll be
Well,
sending them?
if I get this letter and it's got the fit test in it, will I be aware that probably a better strategy is to have one colonoscopy, have a clean colon, and wait 10 years, but they're going to have to do this fit test every year. I'm not against the fit test, don't get me wrong, but I mean, part of it should include that there are other options.
So the way this grant is set up, I don't think there are other options. We'll be getting a list, we'll be coordinating. So the patient education and planning is how the clinics are going to coordinate and inform them that they have this opportunity.
But that's where you guys will have an opportunity for input with the vendor to say, in our letter that's going to go out with this kit.
So I think we can draft the letter or
is that how it
have
works?
input at least on what the letter says, so we could.
Okay, I would just suggest that, you know, I worry that people who get a clean fit test think, okay, I'm good, but you got to do it every year. And a year goes by so fast, they think they did it last week.
Yeah.
You know?
Yeah, and the clinics still have to figure out which lab we'll be using. So,
okay.
Yeah, we just had the orientation and lots of planning is still required. Any other comments?
And that's the grant through the CCO?
Yes. So next, going to the summer food program. So the summer food program will begin on June 26th. And so the slide shows all the weeks that we have already, we have volunteers. We have volunteers from the EMT and police for the week of July 3rd, July 10th. We have Lions Club volunteers who are going to step in. July 17th, the Chamber of Commerce has said that they will provide for a week. August 14th, the Public Health Department is going to give us volunteers, and on August 21st, the library is going to provide. We still have 3 weeks for which we don't have any volunteers yet. July 24th, July 31st, August 7th. So spread the word. We still have to hear back from Sir Optimist, and there was one more. So 2 organizations we still have to hear back from. Vicky Taylor from Head Start has been helping us a lot with hunting for volunteers. So yeah, we are still waiting on Sir Optimist and the other organization, but you can also spread the word if anybody wants to volunteer. Do you want to add something to this, Christy?
Yeah, I'll put a plug in with Charlie since you're sitting right here. For that first week, the week of June 26th, maybe we could ask our department heads if we can have Lake North District volunteers there, and or anybody from the CAC who wants to be there that first week, especially that first kickoff. Sorry, go ahead.
How many hours is this going to take, do you think, each day?
A couple hours a day.
So starting from 10 to about...
At like 10:30, you show up here, pick up the food, and go set up at the park, at the kiddie park. The meals will be served from 11 to noon, and then have everything picked up, packed up by 12:30.
And this is 5 days a week for that week?
The only day we are not serving is the 4th of July. Otherwise, it will be 9 full weeks. What was I going to say? say. Next week, we're going to put together, make sure that we have ordered all of the extra stuff. Rochelle and Francie are running the activities, the fun side of things. And I don't know, Francie's not here, so I don't know, do you have any idea where we're at with the teen volunteers? Do we have any applications? I have no idea.
Great.
I only ask because you're in the same office, so I don't know.
Yeah,
where
great
we're
question.
at.
She's been, circulating the flyers, I know, but I don't know.
Have we tried any?
Go ahead.
Have we tried any churches?
Some of the churches are aware of it. That was Vicky's gonna touch base with Assembly of God and the Baptist Church, have the joint youth group, so she's gonna see if maybe they're a place that has for the student leadership roles, probation, parole, we'll need to touch base with them to see if some of those kids end up, we put them out to COIC as well, so that their kids can be involved. This might be a good way for them
Do you have a leadership team at the high school? Leadership club?
I don't know. Honor Society, the trouble is that a lot of these older kids, and we're looking for, slightly older, not 7th, 8th graders, but sophomores, and that was what we were shooting for. And a lot of them have paying jobs. And they're 4-H kids, that was the other option. I don't know if anybody, because they need community service, but I don't know.
And LD, is there LDS congregation there?
Yeah.
Yes, that would
In
probably.
the back row here.
I'm here.
That would probably be a key one to connect with.
Yeah, I'm sure I will take one of those weeks, I'm just not sure yet which one, so I'll figure out with my wife and some of the others.
What about Boy Scouts? Or
Yeah, I
maybe-
mean, I don't see a problem with, at least 1 week, maybe 2 of those weeks that we could.
For the Boy
hold.
Scouts or?
Yeah, like with the scout program too. I mean, we'll figure this out. This is, as we get started too, and I know some of the families will be participating and being down there, so we'll be talking and we'll make this happen. This is cool. It's cool to see that there's a bunch of weeks already covered, so
Yeah.
this is great.
And there will be training that our vendor will figure out, training-wise, schedule-wise. If anybody needs food handlers licenses, that got covered in one of the grants. It's like $10, but you can go into public health, you guys offer it, or you can come in here and the $10 fee will get paid, and that will allow you to serve all summer. But it's good for 3 years, so that will cover anybody who wants a snazzy restaurant job. This is the logo, in case anybody hasn't seen it, the Summer Meals logo that everybody in the state uses. So that'll go out on all the flyers that Rochelle is working on for some of them. So that's pretty much everything you know.
Could we also put our Outback Strong logo?
I have to say, I think that it's really exciting that the community is pulling together on something like this, as the Head Start program that has done this in the past is in transition with their location for other members of the community to step up. I think it's really marvelous.
How many volunteers do you need, if departments went, like say Lakeview Gardens went? How many people would you need?
You need someone to physically hand kids lunches. You need someone to check the lunches as they're being distributed for what we turn into the state. We need at least a couple of bodies to kind of help police. It's not
So
quite
4
the right
people?
word, but yeah. And then we'll have the activities going. So if we have spares, if we can have 3 or 4, probably.
Okay.
So we don't know how many kids. Vicki said to expect anywhere from 40 to 60. When I talked to the last people who ran it, it was the Y, and I ran into the director of the Y who used to be over here, and she said 100 kids a day. So we don't know.
Do we have a plan set up for training the volunteers?
No, we're working on that.
Yeah. Because I know we're debating like 1 day versus maybe like at the beginning of each week, have the volunteers get there a little bit earlier.
Yeah, maybe that's a question for you guys. What do you think would work better if we had 1 day for everybody to come in to get trained versus say Monday at 9 is always when the trainings are. It's just
Jimmy, can we make sure that the paper puts out that this is happening during that time every week to remind, whether it's in buys or something, so to remind families that this is available.
Right. Christy and I have been talking about getting an article together once the time is right.
And then is there a way to put it on like 211 or the 219 where people can call for local resources? They dial 211 and then talk to somebody and find out what the resources are locally.
Yeah,
I don't know how many people use
It's
it. but-
online,
Is it online too?
211.
It's
Yeah.
a phone call.
But I think it's also online, you can go to that
We
site.
look it up. And then can I request that we buy some like hand wash, little towelettes to give out to kids before they eat their lunch? Just
Do you find those better than the squirt things?
Yeah, I would do the little hand wash towelettes.
Towelettes?
Because some of them might be kind of grainy.
Yeah.
Never know. Just never know.
Promotional materials, that's the other thing. We've ordered a bunch. Everything has this logo. Partners for Hunger Free Oregon is a nonprofit. They gave us a grant and they have promotional materials for everybody. So we will have a banner that'll be up at Daily Days, be up wherever else we can think to put it around town to let people know. Yard signs, flyers that were made for the entire state of Oregon. So it's in English and Spanish, but also in Russian and Vietnamese in case we have any people who speak Russian or Vietnamese in our community.
Yeah.
Stickers, and we might, I don't know. Bookmarks will be at the library, so there'll be all kinds of different promotional materials, and probably I'll be pawning those off on all of you to hand out, so.
In answer to your question though, Christy, I'd much prefer to get trained and then put it to use right away than come at the beginning of June and expect to remember what I'm supposed to do if my week is July 31st. I mean, it's just, that's how I would prefer. But I don't know about others.
211.org, right on the website to punch in your zip code and everything.
And then the resources are there.
Yeah.
The other option for training is some, you could, like the week that public health goes, we could go the Friday before and just see how the people who are doing it, you know, just have them show us what they've been doing. If you train the first group, as long as everybody, you know, it's like telephone thing.
Yeah.
It'll get worse and worse as the summer goes on, but.
I'll check with the state, because I think they do have specific things that
Oh,
you
okay.
say this, and this.
Oh,
It's
right.
the state, so.
Yeah.
So you said Francie is taking care of the activity,
Francie Rochelle, yeah.
so it has to be educational, right?
Some of it does.
Are you planning on doing like the same thing for an entire week, or how are you guys
Yeah.
gonna help with that?
Yeah. To be honest, we haven't quite sat down and made like a plan yet, but I think the general idea is to have like a rotation. So like Mondays are like X, Tuesdays are Y.
Because I'm sure I could talk to John and he would be okay with me bringing some of my dental stuff. And I could alter it in any way, make it like a game or what you guys are doing.
Yeah, I don't think it needs to be strictly educational, right? But I mean, that's awesome if it can be. I think we're kind of hoping to, go for like life skills or like I'm trying to do some like, farm to summer, like ag related stuff.
I'm gonna try to touch base too
But
with
that's
the
would be
people
great.
with the Forest Service and the BLM, so we'll maybe have a horse presentation or a weed presentation.
Yeah. Okay.
Yeah. Fire, I don't
I was gonna say,
Bring
what
the
about
fire
the
truck, yeah.
smoky?
Are you willing to wear the costume?
I'm not. I think that would be a little hot, but they had Smokey and Nissa, and that was pretty cool. All the kids thought that was fun, so.
Any other comments?
Yeah. They're not doing much of it.
So going to the food co, Rochelle, can you give us share some information?
Did we have some photos or?
Yeah.
Cool.
Yeah.
Okay, yeah, so I've been doing the same old stuff, won't bore you guys with the lessons, the taste tests, etc., after school clubs. But we did have an exciting kind of event happen. May 9th, we had some ODA folks, so the director of the Oregon Department of Agriculture was out here visiting Lakeview, as well as like one of her assistants, and then there was some food corps staff as well, so my immediate supervisor at the state level, his supervisor at the ODA, like farm school director, and then also a food corps regional staff, so for the western region, kind of the manager. Yeah, so these are just some photos at Union, which is where we began, kind of the site visit, and they were just, ODA was here like specifically to kind of see how farm to school programming works in practice, and it was kind of like a little bit of a advocacy for like continued funding, because that funding's kind of a bit tenuous at the moment. So yeah, so that was kind of cool to be part of that. We were doing a stinging nettles taste test here, so sauteed the nettles to remove all sting before, you know, kids were eating them. But they were cool. It was, I got them from the Surprise Valley Food Hub. So they were like locally harvested and grown. And so that was great. We have the DOT survey, which is something I tell you guys about. So kind of nice to just visualize that for everyone. This one, I will say, we had like kind of rough results. This one's very much more so across the board. Kind of knocked my average down a bit, I'd say. Just wanted to try to like love it, but that's all right.
What is it?
Stinging nettles. So they cook down like any other greens. But have you ever walked through them? They like, hurt really bad. It's like almost as painful as a bee sting, honestly. Yeah. So they're little plants. They have these little barbs on them. Yeah.
That's 2 months in a row. I didn't even know what you served.
You should come. Try it. Try new stuff. This is the greenhouse out at Union. So that is looking great. And this actually isn't even the most recent progress on the project. There was a work day last Saturday. Probably like 25 folks are out there, teachers and parents. So now there's 12 raised beds within the greenhouse here. Yeah, those all got built in one day. We got all the fence posts put up. So we made a nice deer fence around, planted trees, outdoor classroom. So yeah, it's actually the garden project at Union is really coming together, which is awesome. And then I was at that work party. I was kind of catering it, so I had some money from ODA to provide food. We had a rainbow salad bar and a rainbow fruit salad bar. It's kind of fun. But yeah, this is still the site visit. Yeah, so we were at Union touring, and then here we are. You can see Charlie and Ken Kessner were there as well. This is us at Fremont, AD Hay. So I was taking them around there. They observed a lesson that I taught. We went to some classrooms speaking with Michelle Lee there at the kindergarten level, just kind of showing off using the resources from the farm school grant. Here's this little mobile garden situation that Sing helped me kind of get going. We used an old desk and an old little cart from the hospital warehouse. So we kind of went treasure hunting one day, found those, turned them into some gardens on wheels. So this one was planted by a kindergarten class. And some fourth graders made this little sign welcoming ODI and Food Corps.
Yeah, I didn't get the pictures of those butterfly nests they had created and all the other plants that they were. Oh,
at Union. Yeah, they just have some larvae going and some butterflies. Again, yeah, materials from the ODE Farm School Grant, not the ODA. So.
Because that's all the pictures we had.
Okay. Yeah, so yeah, it was a successful visit. Got good feedback from the director, and I think it made a good impression. So hopefully, if she, has decisions to be made in like the realm of farm to school, she like has a positive kind of association and like thinks that's a productive use of funds. Other than that, I took 50 fourth graders on a farm to school field trip to Holland's Dairy in Klamath Falls. Picked the one rainy day in like the past 2 months. It was pouring rain, it's freezing cold. But it was a good time, the kids enjoyed it, and I got to use some ODA grant funds for that as well. So yeah, Christy, I do need to touch base with you on the next reporting. Because yeah, we've spent some money finally, it's exciting. And I think other than that, the last thing is just the garden here at Lake Health District Hospital. I'm wondering if people like have thoughts or desires to, change it from a patch of weeds into something else. I don't know. I could definitely take it on, but I guess I was hoping Charlie was going to be here. But is the hospital willing to put some funds towards that? Same, do you have an idea, or we can?
I don't know. I can.
That's probably a Charlie question. Yeah. I don't know if anyone has a what do you call it, a rototiller, right, to turn under the. I was out there the other day. It's just
it wouldn't be
so
hard to
many
find
weeds.
someone that would
Right.
to donate
Yeah.
a fruit there too.
Yeah, and I know it was kind of a community garden space in the past. I don't know if people think that's a good idea to continue with that kind of model. I don't know if people paid for a plot.
No, they just showed up.
They just showed up.
What about talking to physical therapy and having that be part of an activity, they go out and garden for
Yeah.
20, 30 minutes, depending
Or-
on where they are.
Yeah,
That'd
yeah.
be
Or like
called
Lakeview Gardens, like some
occupational
seniors who are more mobile. Do you think? Yeah. Yeah, I don't
You
know.
said you can't take it on, or you would take it?
I would take it on. Yeah. But just, looking for ideas or
Aren't you
thoughts.
leaving soon?
Here's an idea.
Yeah, July 31st.
Okay, so has your replacement been identified?
Yeah, so I forgot to mention that. Yeah, me and Singh are currently interviewing this week prospective food corps service members for next year. So we conducted 2 interviews on Monday. They went well. And then we've got 2 scheduled for Friday
Yeah.
with potential for a few more even. So
Okay.
yeah, so then they should be arriving sometime like mid-August.
So the hospital one, you're trying to think about growing, putting seeds in the ground real fast.
Yeah, or like, even like you buy some seed starts,
Starts.
or yeah, some starts from, yeah.
We can't start planning here until after Memorial Day anyway, so.
Yeah, so we're not totally behind, but I think the main question is like, where's that money coming from, if it's coming from anywhere?
And here's an
then
idea.
what's the best
You
use for it?
incorporate intergenerational activity by having seniors and kids do things together.
Yeah, I love that.
Jess, food services manager, Jess.
Yes.
She and her daughter are the ones who pretty much ran the whole thing last year. I don't
Really?
think by choice, but I think that they were the warm bodies who
Okay.
worked it, so maybe the choice was.
Perhaps we'll like. Cool.
Thank you, Rochelle. Could you share some update on grants you're working on?
Grants I'm working on a smallish one, a patient safety grant that would buy equipment that's in the hospital budget right now. I think it's a recliner. I think that's what we landed on, a recliner that the arms can drop and they can move patients from there to a wheelchair or to something. Teresa Squires, I can never remember her last name, has been working on a patient safety program that incorporates her department, acute and physical therapy. So together we're putting together this proposal that is through Coveris, which insures the hospital. So anyway, that's a little grant that we're working on. And actually, Beth, I need to touch base with you and give you a present. This is a zero suicide. It's not a grant, it's a cooperative agreement, which is basically the same except the government is a little more heavily involved if you are successful. So this one would require a partnership. I've talked with Trace at the Wellness Center. I've given this to both the clinics, to Abby, the emergency department, Charlie Squires has a copy of it. They want the, not Squires, Charlie Pike they want the veterans involved in public health, and if we can all come together and come up with a program. It's in part because we are so small that we don't have as many people to, excuse the statistics, but Lake County's suicide statistics, statistically, we're pretty high percentage-wise. And the goal of this is zero suicide, which everyone can agree is a good goal. So that'll be something that I'm hoping we can put a team together, put a plan together, and get some grant dollars, cooperative agreement dollars. Otherwise, we're kind of in a holding pattern.
Could that grant money be used to promote mental health first aid?
Possibly. They have really specific
Things that you want to do in the cooperative agreement, okay.
The other thing that, and I'm going to put a bug out, if anybody sees anything, one need that is coming up consistently is the need for transitional housing. And this came up when I was working with Jake Greer on the drug treatment court grant. We don't have anything. We don't have a shelter. We don't have anything like that in Lake County. So if you are coming out of rehab, if you're coming out of any kind of program, if you're coming out of prison, if you're coming out of the jail, if you just need to escape a bad situation for a little bit, we don't really have anything. Like Newcomb puts people up, and we have hotels, and that's really it. And so we are looking for some kind of shelter, transitional housing type option. So if in your travels you come across anything, please let me know. So, yeah.
You mean a grant source?
Grant source.
Anything going on, Rod, around transitional housing?
Transitional, OB does have that with, they have some funds towards putting in some housing, so whether we want to have them connect.
That was the mental health one, but she was talking about while you were out, like people transitioning from prison or rehab or.
Mental health is another need, so.
Right.
Well, the one project that they're going to be looking at doing is it's going to include transitional.
Is that
as well.
small houses in
Yeah.
Grand?
Yeah.
Okay.
So, yeah, we can talk about that.
Okay.
Connection. So that'd be a possibility.
And I think there's probably some, never mind.
Wasn't there talk at some point about including housing? It seems like you had talked about including that through the EOCCO dollars.
Yeah, it was not required with the agreement that Oregon made with the feds because we speeded it up, not knowing what was going to happen with the administration. So that was backed out. It was not required.
Okay.
But there is an attempt to people maybe want to close the mental hospital in Junction City, the state-run hospital,
Right.
and that would push
Yeah.
dollars out into the communities. So
Okay.
That hasn't happened yet, but there, understandably.
during this session. But the Department of Justice has told the state of Oregon that we have too many people in institutions.
Thank you, Christy. So in the packet that I've handed out to everyone, there's a walkthrough. Jamie, would you like to share some information on that?
Sure. The Oregon State University Extension Service houses a grant through the Arthritis Foundation to host Walk with Ease. We first brought it to Lake County through an in-person program that we held a couple summers at the track in the morning. We had volunteers lead educational meetings and people walked. Then the program did some transitioning to offer like a self-directed program, and people were still offered a nice book. So now it seems like they're moving to this virtual class where people can still participate in the walking program, whether it's themselves or a small informal group, and then join twice a week on Tuesdays and Thursdays, and it looks like they're scheduling it over like a lunch hour, and people could connect via a conference call, or I think there might even be like a Zoom meeting connection available too, for people to do that no matter where they're at. We just found out about this last week, so we're just trying to get this out to the community so people, if they are interested in a structured walking program, learning some skills to walk safely, this is a great program for that too.
Thank you, Jamie. And one last thing before we adjourn the meeting.
Is this a new logo?
Yes, OSU extension, or OSU went through a new branding process, and this is a new logo for the university.
Yeah.
We're going to be in transition for about a year because it's a large institution.
Oh, yeah.
But this is
That's the first time I've seen it, so cool. I like it.
What is on the right-hand side, the little crown looking thing?
I know, that's the sun. It's supposed to be like the coast and the sun and the mountains and, yeah.
Drops of rain, somebody reading a book, cutting trees down with a
There are.
beaver.
Kind of a busy logo, I'll put it that way.
Thank you, Jamie. So people from OHSU who are working on the HART program, that is the Hartford Award for Research and Practice, had a presentation at the hospital this morning. I have included the slides in the packet, which I've handed to you. They gave us data on how Oregon has more percentage of seniors compared to other states in the US, and how the rural areas in Oregon have a higher percentage of seniors compared to the rest of Oregon. They want to carry out a study in Harney County and Lake County, which would involve an audio recorded 60 to 90-minute interview with seniors in their homes. The sample size for the study between Harney County and Lake County is 20 to 25 seniors, which is not a lot. Once they conduct the required interview, based on the feedback and findings, OHSU plans to develop a process that can benefit the seniors in the rural communities. Seniors have to be 75 and older who would be willing to be interviewed. I have included a recruitment prompt that can be used if anyone knows of a senior who would be willing. Could be your neighbor or family member. If you know of any seniors that are a good fit for the program, you can contact the OHSU representatives who are here today. I'll be sending their contact information to all the CAC members by email after this meeting. So, just wanted to put that out there.
I don't want to complicate things, but I'm just curious, is this an institutional review board approved study? Did they mention that?
Not that I can remember. Do you remember?
Did they say that the people that participate would be compensated?
No.
No.
They won't be?
No.
They won't be.
Then it's probably not an approved study because you have to pay people who participate in research.
Yeah, I can confirm on that and get back to everyone. But nobody's going to be compensated. It's voluntary.
Well, but people at OHSU are going to be compensated. I'm just telling you that.
So any comments or questions? Yes, we can.
It's an assessment, is what it is.
Yeah.
Okay, yeah.
And it's targeted apparently at isolated communities and elderly people. So I think we can encourage people to do it. It would be good. It would be good information for this group.
Yeah, I'm just curious how they're finding with quality health, the older adult initiative doesn't look like whether they're talking to each other at all.
Yeah.
I gave them your contact information. So they might be. So I guess we can adjourn the meeting.
Can I put in a plug for something
Yeah.
real quick? So Kathy Miles with the Youth Mentor Program is trying to bring this, it's SAFE is the acronym, it's Screening Applicants for Effectiveness, and it's specifically to screen volunteers who are working with youth. And I don't really know much about it, but to bring it to Lakeview, I think you were on the email, we need 20 people, do you remember? She needs 20 people, and it would happen June 16th or July 19th, are the 2 dates. So I'm just gonna put the word out there, if anybody works with kids or knows of volunteers working with kids, this is a good training that covers all of the horrific things that you need to be aware of for adults working with children. And Kathy's the contact.
Did you let
for that.
churches know that?
That's a good idea, we should put it out to the churches.
What dates were those again?
June 16th or July 19th is what her email said.
It says it's CDPR though.
And Kathy's number, if anybody wants it, it's 947-4880.
It says it's embracing and I do community-based participatory research and I tried to get as much money to the community as I could. That's it, to have that value. If they're not paying these people for their time, there's something wrong.
Any comments or questions? Or we can adjourn the meeting.
In those, there's surveys of older adults, like 5 minutes of time right after.
Mom said,